We're going to dilute up a reticulocyte stain here. Again, we're going to use EDTA plasma properly collected and labeled. And again, we're going to mix right before we do our testing. We're going to take a 12 by 75 tube. We're going to label it with the patient's information. And all we want to do is put equal parts of supravital stain, in this case new methylene blue, and blood. A lot of students want to take their pipette and pipette exacting amounts. It's not that big of a deal. When we do babies, we actually put a little more stain than we put blood, simply because babies' crit's a little higher and it stains a little better. So all you're going to do is put like 2 drops of blood, then we're going to put 2 drops of stain. And if you get 2 drops and 3 drops, or 3 drops and 4 drops, it's not really that big a deal. Mix it just a little bit and let it sit for about 10 or 15 minutes. That way the RNA in the reticulocytes will take up the stain. Then you're simply going to make a slide just like you do for a normal differential. We also have prepackaged kits. This is one type where the retic stain is already in the bottom. All you do is crack off one of the vials, take your blood, label your tube, mix the blood, take out a couple drops, put 3 to 4 good-sized drops in here. Then you just want to either want to vortex it, or you need to flick it real good so that you make sure that you mix the blood with the retic stain. And you notice as you tap it real well, it comes loose and mixes with the blood and makes that kind of black color. Then again, you let it sit about 10 to 15 minutes and make slides just like you do for a diff.